I guess the question I was trying to ask was, do you, for the client to remember something that's in their subconscious, do you have to take them through some kind of meditative process to get there?
No. No. If I'm having to go through those lengths, it's like I'm having to go in. And for me, it's more, let's allow the natural process. The body will give you what it's ready for. Yeah. I trust that 100%. Yeah. I don't want to dig into it. It's all about being with that person's capacity. So if I'm having to go into the subconscious to go on that level, that's the level I'm not comfortable with working at. There's a reason why it's on the subconscious level. Yeah. And it's more like, let's be with that. Let's be with, if it's really deep down, and some people would just be like, there's something wrong. Maybe there's something I've forgotten. Maybe something happened to me as a child. And, I'm not going to be like, it's not my job to be like, okay, well, let's think about it. Who can you ask? And let's try and figure this out. It's not about that. It's just to go with that, so what's going on in your body as you're thinking about this, as you're thinking that, I don't know, what if something happened? And then there'll be like, there's this panic. And it's just like, okay, can notice how that panic shows up in your body, And then what you tend to find is that, people have a lot of resistance pieces before getting to things like that. And then what's important for me is like, let's be with the resistance without trying to peel it back and without trying to make that resistance wrong. To just hold that space of that resistance is protection. Yeah. And that has really served you at some point. Can we be with that? It's okay,
Yeah, so what it sounds like to me is the work that you do, you're peeling the layers of an onion piece by piece.
Yeah. Based on the client. It's not based on what I think needs to happen. Yeah. It's based on the client and where they're at. Yeah. And I'd say like the resistant pieces to, well, that part doesn't want to do that part doesn't want to. And then it shows up. They dissociate. Suddenly they feel really foggy and they can't feel their feet. And again, it's like, okay, let's notice that. Let's be with that. And if I think they're in trouble, it's like, okay, let's bring in a bit of movement. Let's switch things up a bit. But even dissociation, you can be with it, and the body can naturally come out of it as well, given the right environment, I suppose.
It sounds like a very kind of gentle form of therapy.
Extremely gentle. Extremely gentle. It's not about getting in. It's not about, we're trying to come out of the mentality that we have of stiff upper lip and keep calm, carry on, and, avoid. It's just like, okay, let's just notice, but we don't need to dig in. Let's just notice. And, like we have conflicts, like one part wants to do this, one part wants to do that, and it's like, okay, let's just notice. What is it like to just allow both to be here equally? And what people tend to find is like, oh, it's all right. It's, when we actually allow it, and even just allow the resistance, it's like, notice how that resistance shows up. And then it kind of drops, because that part kind of knows, well, I can be here, actually. It's all right. I'm not bad. I don't need to be gotten rid of and things. So things start opening up. It's really developing safety on an internal level. Yeah. As well as, the outside environment. It's just letting within know it's okay. It's okay.
Yeah, it's interesting. It sounds a little bit to me like I would describe it as feeling therapy.
Yeah. Yeah. But, I can get people that can't feel. They have no concept of feeling. I can ask them, what does that feel like? They're just like, I don't know. And from there, it's just like we might, you can hear in their language, like if they say, I see this, or I think this, is just like, okay, do you get a visual? Do you get an image? Do you get a sense? Can you stay with that sense? So yeah, as much as somatic is the felt sense, sometimes people don't have the language for it. Yeah. And sometimes And what's interesting is a lot of the time when they don't have the language for it, it kind of gives me a key to, we could be hitting into something that's pre-verbal when they're babies and they don't have the words. So to also hold that space as well.
Yeah. Yeah, I guess,
Yeah.
I don't know what your thoughts are, but someone that's not feeling, shall we say, it could be that that's just not their language. They might just be, for instance, very verbal or very visual, let's say. But also,
Yeah.
I guess it could be that they might be a feeling person, but they just don't want to feel that emotion.
Yeah. I kind of believe that, you know, if people are showing up to a somatic session, on some level there's a concept of feeling. There's a concept of the felt sense, rather than that being that, you know, not their language. Is that, you know, if there's something, if they're showing up for that, then I'm just like, well, we have to acknowledge that there's a part of you that wants to feel.
Yeah.
Because you wouldn't show up to a somatic session.
Yeah. Yeah, I guess ultimately they want to feel better.